Good evening and hello. I am Ellis Dean, your host from blackdoctor.org. Thank you for joining us for this community conversation about an important topic for everyone 65 or older, and even those that are getting close to that age. Because I know that, look, don't click off. It's for 65 or older, but even those that are getting close to that age. Our topic tonight is Medicare, specifically how to navigate Medicare enrollment. Medicare open enrollment time is right now, like right now. It started on October 15th and runs through December 7th. I'm going to say that again. It started on October 15th and runs through December 7th. So tonight we're back with another panel in partnership with Cedars Sinai as we discuss the basics of Medicare and answer your questions about enrolling in, changing if necessary, and using your Medicare benefit. This discussion is also available via simultaneous interpretation in Spanish on our Daily Vitamina Facebook page. We're talking about Medicare because, frankly, it can be confusing. To help us make sense of it all, we have some great panelists joining us this evening. Let's meet them. First, we have Pamela J. Gentry. She is the Deputy Director of the Office of Minority Health for the Centers for Medicare and Medicaid Services at the Department of Health and Human Services. Pamela works to advance the agency's commitment to and investment in health equity for underserved populations, including policy and program innovation to advance health equity. Next, we have Bruce Young. He is a director of managed care and payer relations at Cedars Sinai in Los Angeles.
Good evening.
We also have Dr. Wendy Norman. She is a geriatrician and the pioneer physician behind the new Cedars Sinai Senior Advantage program.
Hi, all.
And hopefully we'll have Miss Betty Goodman. Miss Betty is in her 70s, and she is a Cleveland, Ohio resident who has been on Medicare for a while.
Perfect. They can hear.
And she's here to share her experience with initial enrollment, open enrollment, and this whole Medicare process. She joined us last year for our program on this topic. And let me tell you, Miss Betty was a rock star, and she is an expert in this whole situation. So we're hoping to have Miss Betty joining us again this evening. So we've got a lot to talk about today. So let's get started. First question is for you, Pamela.
Okay.
Why is it important for the Office of Minority Health for CMS to be out here tonight talking about Medicare enrollment?
Well, first of all, I want to thank you so much for having me. We love doing events like this and getting to speak directly to people. Looking at Medicare and health coverage, because, CMS is one of the largest health insurers. We cover more than 150 million people across what we call our 3 M's and CHIP, Medicare and Medicaid, the marketplace, and the Children's Health Insurance Program. Right now, millions of people are on Medicare. And whether you're new to the system or you've been with Medicare for a long time, you're able to look every year at your plan and make sure that you have the right one for you. A lot can change and the plans might change, but your needs could change too. Sometimes you have different requirements for medication or for services and certain prescription drugs. So you want to make sure that you shop around and find a plan that really works for you. But to your point, CMS is really committed to advancing health equity for all Americans. And my office is really tasked with helping to ensure that health equity is a part of everything that CMS does. So that includes Medicare enrollment. And we're thinking about this, how this affects people of every racial and ethnic community, people with disabilities, people who live in rural areas, or geographically challenged areas like territories and in urban areas. So we look at non-English speaking, the LGBT community. There is no one that is overlooked by my office. And each of these groups has a hurdle or a barrier to finding good health and good and quality health care. So our office is critical in that, and we work across the agency. We work with every part of the agency to make sure we ensure that. We need our listeners tonight to think about themselves as well as family members and members of their community who might need a little extra help to be encouraged to shop around for plans, or maybe could help connect them to someone who can help them. So I'll be talking about that a little bit later. But I'm so grateful to have a chance to talk about the importance of shopping for plans and applying for financial assistance in your state with Medicare shared savings programs, or learning about other new savings like vaccines and the cost of insulin. We're committed to helping everyone achieve the best health care possible, and we can't do it alone. So a night like to this, where I get to talk to all these people who can help us, is very rewarding.
Absolutely. So, you know, as with any insurance plan, Pamela, there are some changes. So I'm sure there's some changes to Medicare this year, including some important new benefits. Can you tell us about those changes and those new benefits?
Yes, absolutely. And they're good changes. First off, you still can always review the plan that you have every year. And even if you like the one you have, there might be something new that you want to experiment with. So, but plans may change a little bit each year. So it's good for you to be sure that you have the right plan. And that's why, having this conversation tonight is so important. But I do want to flag a few changes that I want to mention. There could be a lot of savings for your listeners, so we want them to know. So, for first one is if you have Medicare and you take insulin, you'll pay no more than $35 a month for supplies for each covered insulin. This includes people who have Medicare drug coverage, which is called Part D, and we'll talk more about alphabet soup later, and Part B covered insulin. So, so people with Medicare drug coverage pay nothing out of pocket for recommended vaccines, including the shingles vaccine. And I'm sure everyone has now had their COVID vaccine because the boosters have been released for a couple months now. But this includes all of them. And the Centers for Disease Control and the Prevention Advisory Committee on Immunization is who we took our cue from on what immunizations would be most important and most vital for people over the age of 65. So in 2024, people enrolled in Part D who have very high drug costs will get some relief. Once they reach a certain threshold of paying out of pocket costs, what we call the catastrophic phase, they'll no longer have additional cost sharing and copays to the pharmacy. And that's important, I'm sure, to everyone's pocketbook. So if you or someone you know is struggling with prescription drug costs, there's extra help in Medicare programs that can help pay for the drugs covered by Part D premiums, deductibles, and coinsurance, and other costs. The program will expand to cover more drugs and more drugs for people with limited resources in 2024, which is right around the corner. And these are good things for seniors, but especially for those who take insulin or need prescription drugs.
Look, you had me at $35, Pamela. So I'm just going to tell you right there. You had me when you said 35. I was like, okay, I'm ready to sign up. I also want to say thank you for everybody that's dropping their city and state in the comment section. Keep them coming. So all my Los Angelinos from Compton to Rancho Cucamonga, from Beverly Hills to Brentwood, let us know where you're watching us from. Drop your area in LA, because I know it's a lot of small communities in the LA area. So drop your community. If you're watching us from LA, please drop your community, your city where you're. I see West Hollywood. That's what's up. Santa Clara, keep it coming. So I appreciate that. And also, if you're watching us, share this program if you can with people that you know might need this information. So we want to get this information out to as many people as possible. So share it on your page or tag a person that could use this. And also, if you have any questions, because we're going to be talking a lot and it's thick. Betty's going to show you the book. The book is thick and there's a lot of information in there, but we're not going to be able to get to everything. So if you have any questions and we can get to them, please drop those in the comment as well. Encino, Studio City, Beverly Grove. Okay. All right. We got all the folks coming in from LA. That's what's up. LA's in the house. So sorry for that parenthetical pause, Pamela.
No, that's fine. That's fine. I'm going to give a shout out. I hope someone's on here from Detroit. That's my hometown.
Well, shout out to Detroit, all the Michiganites there as well. So, Pamela, we have a large audience across the country, because I saw some other folks from around. I saw Chicago in there, and some of them may be eligible to sign up for Medicare for the first time. Can you give us a basic rundown of when you should sign up for Medicare?
Well, yes, because generally most people enroll, everyone gets their AARP card a little early, sometimes before they're 50. So they're a little hesitant when they see the mail that comes from Medicare. But most people enroll when they turn 65. And it's called the initial enrollment period. And it lasts for about 7 months. It starts 3 months before you turn 65, and it ends 3 months after your 65th birthday. Now, people with disabilities, as you may know, adults and children are with disabilities, they're eligible for Medicare without the age requirements. I just wanted to point that out. But to enroll in Medicare, most people need to contact the Social Security Department directly, Social Security Agency. It's recommended that you do it before your 65th birthday to avoid a lapse in coverage and avoid any penalties for applying late. And you should receive a packet in the mail from Medicare before you turn 65. They start mailing those out maybe 3 or 4 months before your birthday. And you can always enroll online or in person at a Social Security office, or the good old 1-800 number still exists, 1-800-772-1213. So those are all the ways you can enroll.
Well, maybe we'll get that number put on screen. Our producer can put that on screen so our folks can see that. That again, that number is 800-772-1213. That's an easy one. So now we're about to take a turn.
Okay.
And get to the alphabet soup that you mentioned earlier. All right.
Okay.
And so
okay.
I'm old school. I may look young. Thank you, Mom. But I'm old school. And when I see A, B, C, and D, I start thinking about grades. And A being the best. Please.
Well, let me tell you, all of these are A's. We only have them B, C, and D because of the order, but not because any is less valuable than the first.
Okay. All right. So I need to know. I'm like, ooh, I don't want any D's, but I need you to help me. So when we sign up for Medicare, what exactly are we signing up for?
Well, Medicare has 4 parts, and that's what I call the alphabet soup, A, B, C, and D. And Part A and B are both referred to as original Medicare, and this is what we call fee-for-service health plans operated by the federal government. They're operated by the federal government, but private health insurance companies or nonprofits run them all. So there is nothing called the government health plan. You'll have Blue Cross or United Healthcare or Cigna. There are lots of different plans that participate in A and B. Then there's Part C, called the Medicare Advantage Plan or Medicare or the Medicare Health Plan. And this is where individuals may purchase these plans through private insurance companies approved by Medicare or their certified independent insurance agents. And you also have the option of getting prescription drug coverage. That's the Part D. That's why I say it's not a bad thing because it helps you pay for your prescription drugs. So that's A, B, C, and D. And lastly, if you don't elect to purchase a Medicare Advantage plan, you can purchase a Medicare supplemental insurance. And supplemental means it's added in, so we call it Medigap, and it covers out-of-pocket expenses that Medicare does not cover. Now, you can enroll in both a Medicare Advantage plan and a Medigap plan. So you must enroll in Part A and you must enroll in Part B to sign up for C and D. So that's kind of the basics, but we can talk a little more about it later.
Okay. All right. So there's the number. I saw somebody in the comments said, okay, it's on the screen, 800-772-1213 if you want to call them directly and get that number. So we'll show it again throughout the program, and it's also in the comments, so you can get it there as well. So we want to make sure you got that because that's important for signing up. All right, so I got to get A and B,
okay,
to be able to get C and D. Now,
right. Mm-hmm.
All right, got that part. Now the other part I want to know is it's insurance, and I have yet to run into insurance where I didn't have to reach into my pocket and pay something. So what are the costs that's associated with Medicare?
Well, Part A covers your like hospital and Part A covers your doctor's visits and things, and you may have a copay for the visit, but not for the treatment, let's say. And then Part B is primarily your hospital coverage. Okay. And Medicare covers a lot of the hospital inpatient things because it was early on when the program was designed, they found that was the most expensive part of healthcare at the time. Now I don't know if it's as bad if it's as expensive as prescription drugs because people take a lot of them, but that's Part B. And then, like I said, Part C offers you, most enrollees don't pay premiums for Part A because they paid into the system. And so that is a little bit more controlled. And then, like I said, and then Part B, you have less to deal with because it's primarily if you get into catastrophic care, if you're really in a hospital a long time, you could run up some bills there. But usually Part B covers, I think 80%. So once you hit your 80% mark, sometimes you have 20% that you are responsible for, and that's where the Medigap or the supplemental programs come in to help you.
All right, well, that's good because Bruce, I'm going to give this question to you later on in the program when we come around to you. But there's a question from Robin. She wants to know, can you get Medigap if you have a pre-existing condition? So that's a question. So I don't know who can answer that question or if we can answer that question today. But that was a question that's coming from audience. So it's a great question that's coming in. All right. All right. So Pamela, you're on fire right now. I'm just telling you right now. You are hitting it out the park right now. So, all right. So let's talk about Part C and D. All right. So from all the ads on TV to well-intentioned advice from friends, and I love my friends, but sometimes, they can give you some bad advice. Where can people go to find trusted information about all of these Advantage plans and the prescription drug plans?
Well, I would say the first place to go is to CMS, Medicare.gov. And on Medicare.gov, we have what is called the Plan Finder, and it will give you all of the plans in your area and your state, and it will also tell you what those plans offer. So that's where I would start. We also have, well, let me see. I guess that's where I would start. We also have a 1-800-Medicare number. So that is always easy because it's 1-800-Medicare. So that would be the second place I would tell someone to start if they really don't have any idea where to start. And then last but not least, they would, both of those locations will avail them to the Medicare handbook, which we're going to talk about later. So those are probably the three basics. So does that kind of get them started, or did you want a little more?
No. That's perfect. Look, we got a call to action. You just gave us what is known in the business, as we say in the business. That's a call to action. Right. So the call to action is you can go to Medicare.gov, right? So if you're using your computer, if you super old school, you want to pick up a telephone and talk to a person, 1-800-Medicare, the number's on the screen, you can do that as well. And so we have multiple ways to get to the same end, or you can get that book that comes that Betty's going to show us about. You get that book as well. So there's multiple ways to get that information that you need. Right. So you knocked that out the park again. You're on fire. I told you you're on fire tonight. So all right. All right, so let's switch. So we're going to switch. I'm giving you a break, Pamela. You can get a drink of water because you've been talking a lot. So if you need a drink of water, get a drink of water. So I'm going to go to Dr. Norman.
I have one right here.
So, Dr. Norman, let's talk more about the Advantage plans. And you're a great person to ask because you're launching the new Cedars Sinai Senior Advantage program.
Yes, I am.
What are the kind of services you're offering your patients in Los Angeles? And you saw we have a lot of them, Los Angelenos that are on here. And for our patients that are not in your area, what kind of questions should people ask when considering an Advantage plan?
Very good. Well, I'm thrilled to be starting this new program at Cedars Sinai, and they are giving me all the perfect team that I need. So the one and most important thing I think when you look at a Medicare Advantage plan for seniors is who's on your team. So I'm a geriatrician, internal medicine physician. You've got a physician leader on your team. Do I get time to spend with you? So what's special about our plan is instead of that 20-minute visit, we have hour new patient appointments and 40-minute follow-ups. So asking about how much time you actually get to spend with your doctor. I have an exceptional nurse, a nursing team, dedicated nurse who loves taking care of seniors and is able to give that special attention. Do they have the right people on their team? We also have a case manager and a pharmacist. We meet multiple times per week as a team to talk about the people we're caring for and to making sure that we're really I think of myself as a quarterback, that I'm throwing the pass and I'm making sure I'm getting completion so we can get to that end zone for all of you and helping you live your best life. So the other thing I think it's very important that we have at Cedars Sinai in particular is I'm the primary doctor, but what other doctors and services do I have that I can easily access and easily make referrals to and get curbside consults with. So we have an outstanding selection of specialist physicians. I can do an easy referral. I can do an e-consult, which is something new for me that I can just hop on. I can send literally a message with a copy of your last note and get literally instantaneous feedback from my specialist group. You want that type of coordinated care. So that's those are the things that I'm thrilled to be starting here at Cedars Sinai. And those are the key elements you should be asking when you're looking at Medicare Advantage programs. What types of services? Who's on your team? Who's going to be coordinating that care? So that's what I would say is the most important thing looking at it. The other things I think for people that are outside the Los Angeles area is you look at your hospital network, your specialists that are involved in the care, and that extends not just the medical specialists, but your physical therapists, your anybody else that's on your team, ophthalmologist, your audiologist that's helping you with your hearing, your dentist. All of those people are critically important to make sure that they're integrated into the Medicare Advantage plan that you're in. If you're switching plans and you have favorite doctors, that's another critical point, is to before you sign on the dotted line for a new plan, look through and have your broker, whoever's helping you, look at that. Make sure that your favorite folks, your favorite hospital, your favorite doctors are on the plan that you're choosing.
Excellent. So Bruce, we're coming around to you. At Cedars Sinai, you offer your Medicare eligible patients free resources to get assistance when selecting a Medicare plan. Help us learn more about those free resources, because I like the word free. It's one of my favorite words.
That's right. Everybody loves free. First of all, thanks for having me tonight. So Cedars Sinai on its website, where it's just cedars-sinai.org/Medicare, is the website portion of our insurance page that provides very brief descriptions of what Dr. Gentry had presented earlier about the definitions of A, B, C, and D, and that it also discusses a little more in depth about Plan C, in that it combines all three of the A, B, and D pieces together in a single insurance product. And then what we try to do is, particularly during this time of year, provide what then is my next step. And so I probably will be a recurring theme throughout our discussion tonight, is the importance of finding someone who can help you. And so I completely agree with what Dr. Gentry had said earlier about using Medicare.gov as your first step into learning everything you really can, because it really informs any discussion that you have. But I also feel that it's important to work with a licensed insurance agent, because those folks generally know what's going on in your marketplace, and they know which plans, because of all the work that we do to communicate with local agents and with eHealth. And so we've got the eHealth information up on the screen now. So for folks in Los Angeles, that is the Cedars Sinai landing page or landing phone number for eHealth. And so if you're interested if you don't already have a licensed insurance agent that you normally work with, then we ask people to go ahead and reach out to eHealth, and the 844-566-0190 number is where you would do that. And if you are outside of Los Angeles, shout out to Indianapolis, there's a different number, and that number is area code 888-374-0882. And that goes to eHealth's regular number, because you have different health plans in your area, and they will be asking you, when you get to that number, they will ask for your zip code, and all of the available plans for that zip code will come up, and then there'll be an agent there to help you should you wish to do that.
Great. We're going to put all this information also in the comment section, but it's on screen. This is the number on the screen right now, is for non-Cedars Sinai. If you're outside of the Los Angeles area, non-Cedars Sinai patients, dial this number. You see the days and times that they're open there, so you can call that as well. And then again, if you're Cedars Sinai patients, this is the number for you. So there's two numbers. I mean, they're partial to Cedars, but this is the Cedars folks, so they're gonna do that. They're gonna have special numbers for that. So it's all good.
Right.
So, but we've got both covered.
Yep.
All right. Y'all are just on fire tonight. I love it. I love it. So, Dr. Norman, do all doctors take Medicare?
I would say most doctors take Medicare, but not all. Depends on your area, depends on the specialty. And most hospitals take Medicare, but it's important to ask as you're signing up for your plan again to make sure the doctor you're most interested in is on the plan and accepts Medicare.
Okay. So, Bruce, let's say I found a plan where I can still see my doctor and I can still use my favorite hospital. So that's most important to me. Or what if I review my plan and I'm still happy with the benefits that I had from before? Am I set or do I need to do something?
You're set. That's the short answer. So if your plan is available in the next calendar year and you're happy with everything, you're good to go. Um, Again, about every year, and I think we may have touched on this earlier, but benefit plans change. So when we talk about Medicare Advantage, those are insurance company products that work with Medicare, and they all compete. And so sometimes the insurer that you're already with may already have or maybe introducing a new benefit plan for the coming year. And that's important to know about. And usually those insurance companies will not tell you about the brand new plan that has the better benefits. And really what's important is just making sure that whatever it is that you choose or choose to stay with, because you might change too, the drugs you take or any ailments that you might have, there might be a better plan fit for you in the coming year. And so it's important to be able to work with someone that can talk to you about the types of benefits within the plan or the formulary that the drugs that you're now taking are in the lowest tier for cost sharing that you might have for copays and benefits. Those things are important to be able to know about. So I still, even if you're happy with what you have, I still recommend that you check with a licensed insurance agent every year just to make sure that you're not missing out on something that might benefit you. So right now we are in open enrollment. So as Ellis had said previously, we are right in the middle of the open enrollment period for people to choose. And so the time that you would make your elections to change plans, if you chose to do that, is October 15th to December 7th of each year. So during this time, you can join, you can switch, or you can drop a plan and go back to fee-for-service Medicare. And as long as then, and you would have to do that before the end of December 7th this year. For Medicare Advantage plans, if you chose something during the annual enrollment period, which is ongoing right now, there's a separate period called open enrollment period, which goes from January 1st to March 31st of every year. So this is sort of your fail-safe option. If you made a plan choice to change or to drop a plan or do something else, if you stay with a Medicare Advantage plan of any kind, and you decide that it's not for you for whatever reason, during OEP, the open enrollment period, January 1 to March 31st, you can make a plan switch to one other Medicare Advantage plan, or you can disenroll from Medicare Advantage entirely and go back to fee-for-service Medicare, at which time I think you can go out and still buy a Medicare supplemental plan that we were talking about earlier. And you can only make that switch once. So whatever you do, don't pick a plan and never look at it again. This is an annual thing. And you should be a good client to whatever agent you're working with, or you should always have eyes open during this time of year. But I like the fact that somebody would have a relationship with somebody they already trust, and it's an annual thing. And that's the key thing to remember.
Absolutely. So we forgot to touch on, and I put it in the comment section, but I'd like to touch on, is there financial assistance for people that might need it with Medicare? So I don't know who that's for, but could somebody just kind of touch on, are there some financials? I put the links to the resources, but kind of help people talk through any financial assistance available to them.
So, and I might need a bailout or a lifeline here from Dr. Gentry, but so the short answer is yes. There is something called extra help that is generally available through the Social Security Administration. that once qualified will provide you with additional status that would give you relief on the things that you would normally have as out-of-pocket costs. And in many of those cases, that has to do with anything, if the premium, if any, in a lot of plans in Los Angeles County, at least on the Medicare Advantage, HMOs don't have many premiums much at all, but where you might find a share of cost might have to do with an office visit or a drug copay, coinsurance. Dr. Gentry, how did I do?
You did fine, and my mother is going to be so excited that you've referred to me as doctor, because I'm not a doctor, but
I'm sorry.
No, and she was hoping I'd become a doctor or marry one, so I know she's ecstatic at this moment. But that's okay. Yes, but you did very well on that answer. And the other thing I would add is that there is a situation where someone can be eligible for Medicare and Medicaid. That's a whole nother story. But if they are in a situation where they financially are eligible because of their income, they can also Medicaid. They can also apply for Medicaid, and we refer to them as dually eligible, meaning they are eligible for both programs. But that also enters into their care providers would have to also be accepting of both programs, Medicare and Medicaid. And that, that could be a challenge, but they are out there. So that's another form of assistance that would be available.
And as Pamela had mentioned, I'm not going to refer to you as doctor anymore, even unless your mom calls and says,
right. You're disappointing her every moment.
Those plans, as you had mentioned, are referred to as dual eligible or D-SNPs. And so the names of dual eligible Medicare Advantage plans usually have in parentheses after them called D, and then usually a hyphen SNP. And so and in California, we call it Medi-Cal because we have to be different. But if you are a dual eligible person and would like your benefits coordinated together, look for Medicare Advantage HMO that has the word D-SNP after it. It's a dual eligible plan. Absolutely. And so there are things. Actually, Ellis, I should probably wait for you to ask the question.
So I was thinking about like what you're talking about, making changes or enrolling after the enrollment period. And I wanted to reiterate what are some of those special circumstances that allow somebody to make additions or changes after December 7th. I'm going to say that date again. After December 7th, you said that you could still make changes. You said starting in January through March or something like that. What are those special circumstances that people can make those changes?
Well, okay. So I'm so glad you asked this because I don't want to confuse the two things. So one, anybody who has a Medicare Advantage plan during the open enrollment period that goes from January 1 to the end of March can switch to a different Medicare Advantage plan, or they can just return to fee-for-service Medicare, a traditional original Medicare. Okay. So everybody has that option. However, at the end of that period or throughout the coming year, there are only qualified reasons why it is someone can change Medicare Advantage plans. And those would be things like if you moved out of the service area of the current health plan or just changed counties, for instance. That would be one reason. Losing your current health insurance coverage. So if you were above the age of 65 and you had other commercial employer-driven insurance that you could then switch or join a plan during the calendar year. And also if you had changing coverage through a union. If you have union benefits, you might have a plan that still enables you to make changes. So you wouldn't have a penalty in those cases. And then since we were talking about Medi-Cal or Medicaid, in California at least, you can change plans quarterly if you are a dual eligible person. So if you have one of those D-SNP plans or if you have Medi-Cal coverage, even if you don't have a Medicare Advantage plan, you can still make plan changes on a quarterly basis if you're a Medi-Cal person.
Great. Thank you for clarifying that so folks can get that. And I have one of my favorite new names, Peggy Peppers, is in the comment section. So Pamela, I know you mentioned it earlier in the program, but you may have missed it. How soon before your 65th birthday should you start this process?
Yeah, I think I did it 3 months before, 3 months after you want to get started. So that's the window.
So Peggy Peppers, your birthday's in May, and I'm a May baby myself. So you can start in February, and you have from February until 3 months after. Ooh, I gotta do my math.
August.
There you go. 8. So you got from February to August to do your enrollment there, P squared. All right.
And you register and remind your Social Security Administration.
Yes, please. Okay, you got all right. Just confirming. All right. So Betty, let's shift to you. And Betty, you're our expert. So you're actually using it. So
Yes.
Tell us a little bit about how Medicare enrollment went for you this year.
Well, I didn't change anything, so I basically didn't have to do anything. Everything remained the same. But I will say that last year I did change my drug plan because I found that the medications I was using were costing too much. And so it was better for me to pay a higher premium and get my medication cheaper. And so in the long run, financially, that was a benefit to me. So those are the things you have to check annually. You just can't assume that everything's going to be the same price from year to year to year. Each year, you have to check those prices. And I'm on original Medicare, and I have a supplemental plan, so that's a little bit different. I haven't used the Advantage plan, and the reason I did that was because most of my family is all over the country, and I didn't want to have to, consider if I was somewhere for a length of time, if I was actually in the network. And so this way, I don't have that worry. So, like I said, Medicare is not a one size fit all. You have to consider your income. You have to consider your health. You have to consider what drugs you're using. All those things go into making decisions about what plan you want to use when you become of age. And everybody doesn't get on at 65. I worked until I was 70 and a half. So I took advantage of every year because working to 70 and a half, of course, mean I got 8% boost in Social Security. So that's why I worked a few more years. So like I say, it's not a one size fit all. You have to look at the plans and make sure the plan works for you, not that it works for somebody else. Does it work for you? So you have to look at each of those alphabets to make sure you're getting the right thing for yourself. And every October, this is my favorite thing. Every October you get one of these. I'm not sure if you can see it well, but anyway, what it is Medicare and You, and this is the one for 2024. And inside in the cover, if you don't read anything else, just read the inside cover, because the inside cover is going to tell you everything new that's happened. Everything that's changed is on this one page. If you read nothing else, read that page each year. And in the back, and depending on what state you're in, is all the Medicare Advantage programs in your state are listed in the back with the phone numbers and who you have to contact and the premiums, everything is all in this little booklet. And it always arrives the first week of October without fail. Now the government is really good about that. Every first week of October, by October the 1st, within that first week, you're going to get the new Medicare book for the year. And this is a valuable piece to hold on, at least for that year, because you may not need it for yourself, but somebody else may have questions and maybe they didn't keep their book. And you can go in and look up the information. It's right here. You just have to read it. But I will say, check those prices annually and make sure you're getting the best for the money that you're spending, because the prices do change and the coverage does change and the hospitals do change and the doctors do change. Everything changes. Nothing remains the same. And that would be my advice, to make sure you're getting the, the best for the money that you're paying out. And you're going to have to do a little work. And it's just, if you don't understand, there are a lot of resources, and I'm hearing from everyone on the panel, there are resources and people that you can go to and get help and ask them, what's the best thing to do. If you're still working, go to your HR department and use your HR people, especially if they got a group of people nearing retirement. They know everything that needs to be done. So just stay informed on what's available and what your advantages are for being able to be on Medicare, because this is a plan, it's unique to the United States. No other country has anything like this that insures its citizens. So just keep up with this book. If you keep up with this book, you have pretty much all the information you need.
So on your nightstand should be your Bible.
Yes.
and your Medicare book.
In my kitchen, where I got all my cookbooks, on the shelf, I got double shelves. And in those cookbooks, there's always that, and people make fun of me, and because there's nothing on there, I write it on there, the year and what it's for. And right there in my kitchen is always, I can pull that right out. I know where it is at all times.
Alice, I wanted to mention something else, because that book is, I really am really glad that she's promoting that. There's also another page in there that has all the state health insurance, what are the counselors listed, and they're listed by state, and we refer to them affectionately as SHIPs. And they're counselors like brokers, but they are free to Medicare beneficiaries. So they can go, if they're having problems understanding their plan in any state, every state, there are SHIP counselors, and they have different names. So I'm not going to give them a name because everyone calls them something different, but they're very helpful.
Yeah. Right.
Well, that is great. So Dr. Norman, and there's been a lot of people asking about how they can get connected with you. So I will let you handle that. But once seniors like Betty get enrolled in their Medicare plan, one of the key benefits is an annual wellness visit. What happens at this visit, and why is it important that seniors schedule one every year?
This is my favorite visit of the year. I just have to tell you, I've been practicing medicine for about 20 years. And I think it was a little over 10 years when Medicare came up with the annual wellness visit. So as doctors, we're usually, before with Medicare, we'd only get to bill if we were fixing a problem. So we didn't get to do that prevention. Teaching people, the right diet, the right exercise program, really coming up with a tailored plan. So I've been a champion of the annual wellness visit since it got approved in 2011. So now I feel like an old timer with this. We've been doing it for so long. But what happens at this visit? So first, there's usually in our practice, at least, there's some pre-work. So we ask a lot of questions about your general health, your lifestyle, how do you like to exercise, your social activities, whether you drink or smoke, and for me, it's whether you dance or run. What do you like to do? So we ask about vision, about hearing, about dental, about all this prevention, where usually we're just focused on hypertension and diabetes and hyperlipidemia and problems. This is a chance to go to really take a deeper dive on the prevention side. So when you come in for the visit, sometimes people think that this is an annual physical. This is not. This is an annual wellness visit. In fact, the only requirements, I often do more, but the only thing the doctor or the practitioner needs to do is check your height and your weight, so we can calculate that body mass index and make sure you're the right weight, you're not obese. We look at your vital signs, and then we go over your medical history. We're looking at risk factors for disease by your family history, your current medical conditions, like we said, your healthy habits. And then we come up with your personalized care plan. And so I like to ask about what your goal is for the year. And people say, I want my hypertension to be better. I want to lose 10 pounds. And I'm like, no. What's your goal for the year? Well, I want to go see my grandkids and be able to get on the ground and play with them. Okay, that's a good goal. So what's holding you back? So this is when we look at, do you need physical therapy? Or can you not hear your grandchild? Do we need to look at hearing evaluation? Yes, the blood pressure needs to be right, and you need to manage all your chronic health conditions. Look at nutrition, diet. And one of my great joys is after we come up with this grand plan for the year, and that also includes cancer screening, screening for your cognitive, your brain health. And after we come up with that master plan of all the things that you should do over the year, when I see you back in 3 months or 6 months and I get to take away, you were diabetic, but guess what? You're not anymore. So this is a really critical visit, and it's such a great advantage. And Alice, I didn't tell you the great part about this. Ask me how much it costs.
More greater than what you just said? Okay.
Ask me how much it costs.
How much does it cost?
Nothing. It's free. It's free. So one of the biggest things Medicare ever did, in my opinion, is that annual wellness visit. So make sure you take advantage of it.
So just to be clear, this is separate from your physical, your annual physical. This is a wellness visit.
Separate from your annual physical. And there is some quid pro quos. You have to be on Medicare for 12 months. But don't worry, if you're under 12 months, there's another very similar exam that you're welcome to Medicare wellness exam. So don't miss out. Make sure every year you're touching base with your primary care doctor and you're doing everything you can to live your best life.
So that's this is the night of good news. Okay.
That's right.
October 26th, night of good news. There's a couple of people that are turning 65 that are in the comments. So this is really great news to their ears. Quick question from Donna. Thank you for this question, Donna. If they turn 65 before October, will they just get that book, or they're just going to get that book on October 1st? So like if they turn 65 in April or May, do they have to wait till October to sign up, or are they going to get the book mailed to them? How does that?
As far as I know, it comes out every year since I've been retired. It's always come the first week of October. So my assumption is everybody gets that book at the same time. At least in my neighborhood, mostly everybody gets it the first week of October. There must be the date that they mail them out. So it always will be October.
So Donna and those people that are going to turn 65 prior to, and if October is the back end of that 3-month period, I would suggest around your birthday, calling that 1-800-Medicare number that we put on earlier, and we'll put it on the screen again. Call that 1-800-Medicare number and then ask that question, and they can give you the information that you need so you don't miss that window of opportunity of signing up. So please call 1-800-Medicare, ask those questions to make sure you get the right answers. I love my friends. Everybody loves their friends. They're great for movie night. They're great for dinner. They're great for if you want drinks, go for a walk. They're great for a lot of things. But sometimes they don't give the best advice when it comes to your insurance. So please go to the sources and get the right information. Call 1-800-Medicare. We'll put the California numbers up as well. And people that are out of state, there's plenty of resources available to you. But that is, if you can't remember anything else, remember 1-800-Medicare to get those questions answered with regards to when you can sign up if your birthday is before then. Bruce.
I was going to add one thing. Also, it is available online in English and Spanish, I think, and they're adding a couple of other languages now. But it would also be available online.
That's right, Medicare.gov. So you can go there as well. If you don't want to call the number, go to Medicare.gov and look. I'm sure they've got FAQs and all the special bells and whistles on that site that you can go through as well. So, Donna, we got you. All right, you're not alone. Like Michael Jackson said, you are not alone. We got you. So Bruce, all right. Why should somebody use a broker? And do the brokers cost something, or are they just going to be trying to sell me something that if I'm a senior on a fixed budget, I don't want to buy anything that I don't need to buy. So should they use a broker? And if they do, is it going to cost them something?
Well, so first I wanted to say, why, yes, Ellis, I'm a fan of Betty Goodman, and thanks for asking. And while I'm answering your question, I can't keep track of all the comments, and that's a lot of great input. But I noticed that somebody did ask for the eHealth number for Los Angeles, and so if there's a possibility that we could put that back up, I would appreciate it. So really, to answer your question, Ellis, so it is a business. I can't lie. However, and this is it surprised me when I had coworkers who came to me and asked me about this, who had parents. They wondered if insurance agents cost money. like a consultant fee? And the answer to that is no. I'm sure that if you gave them some lemonade and some cookies, if they came to your house, they would appreciate that. But they get paid by the insurance companies, and they have a vested interest in keeping you as a client. And so I kind of use the analogy of there being sort of a mechanic, and let a lot of people have a trusted mechanic. So no matter how much their email or their mailbox gets full of all sorts of solicitations, they have a person they trust that they go to as their trusted expert. And I feel like I can't stress that enough, is that if you can find one of those people in your own marketplace, or use a eHealth, but it's a big company and they have a lot of agents working in call centers, and so they get commission as well. There may be other things that an insurance agent might sell, and those things you might be interested in, but a lot of them just work on Medicare Advantage plans. And the good thing about particularly local agents is, again, they know the providers, they know which providers are participating in which benefit plans that are sold by insurance companies. And it's in their interest to keep you as a vested, it's in their vested interest to keep you as a customer. I had one other note here. So one of the other things that they can help you with, and so Pamela had said this earlier, where you can do formulary checks on Medicare.gov, but an agent can do that for and with you as well. And so if you're looking at, once you've been through the discussion of narrowing down which benefit plans you like, that you can do these formulary checks to make sure that the medication that you're currently taking is on the best tier, lowest out-of-pocket cost. And I think that's probably it.
So, Pamela, Betty kind of alluded to this. And so many people nowadays don't take Social Security at age 65 and continue working. Mm-hmm. How do we handle Medicare enrollment if we are still working?
Well, you have to, when you turn 65, you have to enroll for Part A immediately within that window that we've talked about. Okay. If you're still working and you're using your insurance from your employer, then you can continue to use that, but you have to enroll with Part A. And then Part B, you enroll in that as soon as you retire or move away from your insurance that you're using through your employer. So you still want to enroll. And then remember, as long as you're enrolled in A and B, you can enroll in C and D. So that's the requirement. Now you can work as long as you like, and you can use the insurance that you're using. But once you stop working, then you definitely want to join Part B. Now, some people decide that they're going to drop their employer's insurance, but that's very, very rare that you're working and you drop your employer's insurance and go to A and B with Medicare. It's not impossible. You can do it, but that's usually how most people kind of age into it. They take Part A immediately because you have to enroll. And if you don't enroll, I guess this is the most important part of this. If you don't enroll when you're originally immediately eligible for Part A, mm-hmm. If you enroll later, like you just don't do it for whatever the reason is, when you come back and decide, now I want to enroll in A and B, you are penalized. There's a monetary penalty for the rest of that lifespan that you're using Part A. Mm. And that is every year. It never goes away. That penalty is permanent. So everyone should enroll when they're eligible for Part A at the age of 65.
Okay, so y'all heard that. Y'all heard that one.
Insurance.
Full stop.
Yeah. If you have an HR department, they usually will guide you because they have employees. I mean, it's not unusual to have employees at 65 or over the age of 65, and they usually will guide you and make sure you get everything set up correctly the way it's supposed to be. It's that helps if you have an HR department. But if you don't, what the information you just gave is really helpful for someone else.
Just two things. One is it's insurance. You don't buy life insurance when you need it. You bought it years ago in case you need it.
Mhm.
And sooner or later, the inevitable happens to all of us. So the paying into it is part of the fact that you're filling the pool full of water, if you will, the dollars that we will all benefit from as a result of paying your premiums. And so Medicare is no different. It is an insurance plan. It just happens to be provided by the government. Just a note on letters of creditable coverage. So if you do work past, to Pamela's point earlier, for every year beyond the age of 65, if your employer provided benefits are of a certain standard that meets the federal standards for what otherwise would be acceptable coverage, your employer provides you, usually in your benefit package, for whenever you renew your benefits each year, a personalized letter of creditable coverage. And so my recommendation to anybody who gets their employment package, and your HR department would be the one to assist you with this, is that you should keep on hand every year that letter at the age of 65 and beyond, that letter of creditable coverage. Because when it comes time to enroll in Medicare, if it's delayed beyond your 65th birthday, that you have your stack of creditable coverage letters that account for every year that you were late in entering into the Medicare system. And if you have not been collecting your letters of creditable coverage, go to your HR department and ask for copies. And I'm sure they get that kind of request all the time. So go back to the HR department. They can be your North Star on all that. Thanks, Brad. Thanks for the interjection.
Oh, no worries. I know there's a lot more stuff that we're going to get to, and so I'm going to answer Pamela's question real quick. Yes, this is going to live on the blackdoctor.org Facebook page. You just go to our Facebook page, click other items and live. It should be under there, and then it's also on our YouTube channel as well. You can do a search on our YouTube channel, search under Community Conversations, and it should pop up. So you have it there. You can share those links with your friends and family. Go review it. Watch this again to get all this great information, because I know it's a lot. All right, and we are coming close to the end of our hour. It's gone by so fast. There's a lot more questions to get to. So I'm going to go round robin as we're wrapping up here. What's if no one remembers anything that we've said tonight, and I'm going to put the numbers and all the contact information on screen while you're talking. If they don't remember anything, what's the one thing you want them to know? So we'll start with you, Pamela. What's the one thing you want people to remember as they're walking away from this program tonight?
Well, interesting enough, Mary Lou Retton, the gymnast who was quite famous, her daughter had started a GoFundMe page because she didn't have health insurance. And that was alarming to me, because really there is something out there for everyone. And there's an affordable way for you to find some level of coverage in this country. And we're very fortunate with that. And one of the reasons that that's true is that while fee-for-service is the original Medicare and it works perfect for a lot of people, but people also love having Medicare Advantage options. And so I think that one of the things that they should take away tonight is that you can find insurance. So find some help if you're having difficulty, but don't go without it, especially at the age of 65 and above.
And then we'll go to you, Bruce.
Things change every year. Find a trusted agent and check in with them every September, October of every year. They can really help you out. That's it.
And Dr. Norman.
Make sure your favorite doctors and team players are on your plan, and get that annual wellness visit.
Love the wellness visit. That's great. And then our star of the night, Miss Betty.
I think it would be just to check your plan annually, at least once a year, to make sure that you're covered for everything that you need to be covered for.
Thank you so much. That is it. This was a great hour. Y'all were just so putting up with my shenanigans, but I thank you so much for that. So, And again, I want to thank our viewers. I always specifically want to thank our partners from Cedars Sinai for this informative discussion. I want to thank you again, Pamela Gentry from CMS, and to Dr. Norman, and to Bruce Young from Cedars Sinai, and to Ms. Betty Goodman, our fabulous Medicare patient, for joining us today for this community conversation. Again, I want to thank our viewers. I hope you're going to remember to go check out your Medicare health and prescription plans every year for changes from here on out. I just want to say thank you again. Get that book, put it in your cookbook next to your Bible, whatever. Keep that. That is your insurance Bible. Please go to all of the resources that we had available, 800 numbers websites in Los Angeles, out of Los Angeles. Request Dr. Norman, because she sounds like look, I want to get 65. I'm going to come see Dr. Norman myself. So I'm going to come see her. And I'm calling Bruce. I don't care. I don't live in Los Angeles. I'm calling Bruce. I'm going to put Bruce's cell phone number in the comments.
Oh my God.
So you can call him. I'm not doing that for real. So again, I want to thank everybody for joining us here this evening. As you can see, it's just insurance, but it does not have to be boring. We can have fun with insurance. Please take care of yourself. Take care of your family members. Make sure they have the right information. Smile, be happy and healthy. And we'll see y'all next time.
Thank you,
Thank you.
everybody.
Thank you.
Good night.
Good night.
Bye.